A new type of super strong surgical tape developed at MIT detaches on demand. The removable adhesive could make it easier for surgeons to close up internal wounds. Last year, MIT engineers developed a double-sided adhesive that could quickly and firmly stick to wet surfaces such as biological tissues. They showed that the tape could be used to seal up rips and tears in lungs and intestines within seconds, or to affix implants and other medical devices to the surfaces of organs such as the heart. Now they have further developed their adhesive so that it can be detached from the underlying tissue without causing any damage. By applying a liquid solution, the new version can be peeled away like a slippery gel in case it needs to be adjusted during surgery or removed once the tissue has healed. This is like a painless band-aid for internal organ. The team's new design is detailed in a paper published in the journal Proceedings of the National Academy of Sciences. In considering designs for their original adhesive, the researchers quickly realized that it is extremely difficult for tape to stick to wet surfaces, as the thin layer of water lubricates and prevents most adhesives from taking hold. To get around a tissue's natural slipperiness, the team designed their original adhesive out of biocompatible polymers, including polyacrylic acid, a highly absorbent material commonly used in diapers and pharmaceuticals that soaks up water, then quickly forms weak hydrogen bonds with the tissue surface. To reinforce these bonds, the researchers embedded the material with NHS esters, chemical groups that form stronger, longer-lasting bonds with proteins on a tissue surface. While these chemical bonds gave the tape its ultra-strong grip, they were also difficult to break. And the team found that detaching the tape from tissue was a messy, potentially harmful task. Removing the tape could potentially create more of an inflammatory response in tissue and prolong healing. To make the adhesive detachable, the team first tweaked the adhesive itself. To the original material, they added a new disulfide linker molecule which can be placed between covalent bonds with a tissue surface proteins. The team chose to synthesize this particular molecule because its bonds, while strong, can be easily severed if exposed to a particular reducing agent. The researchers then looked through the literature to identify a suitable reducing agent that was both biocompatible and able to sever the necessary bonds within the adhesive. They found that glutathione, an antioxidant naturally found in most cells, was able to break long-lasting covalent bonds such as disulfide, while sodium bicarbonate, also known as baking soda, could deactivate the adhesive's shorter lasting hydrogen bonds. The team mixed the concentrations of glutathione and sodium bicarbonate together in a saline solution and sprayed the solution over samples of adhesive that they placed over various organ and tissue specimens, including pig heart, lung, and intestines. In all their tests, regardless of how long the adhesive had been applied to the tissue, the researchers found that once they sprayed the triggering solution onto the tape, they were able to peel the tape away from the tissue within about 5 minutes without causing tissue damage. The researchers also fabricated a version of the adhesive that they etched with tiny channels the solution can also diffuse through. This design should be particularly useful if the tape were used to attach implants and other medical devices. In this case, spraying solution on the tape's surface would not be an option. Instead, a surgeon could apply the solution around the tape's edges where it could diffuse through the adhesive's channels.